that you are not visible on the screen. Only Dr. Kasouaher and the Alumni Relations team will be seen. The webinar will be recorded and will be made available on the Alumni Celebration website if you want to rewatch it later or if you want to share it with someone. Your microphones have been muted, but we definitely encourage you to ask any questions that you have at any time using the Q&A function at the bottom of your screen, which is the yellow circled icon in that screenshot there. We will monitor these questions and give Dr. Kasouaher the opportunity to answer them at the appropriate time. There is also a chat function, and you can use that if you want to make general comments, or you can communicate with Lindsay and me if you are having technical issues. And of course, please be respectful and polite throughout the webinar. Thank you so much for being here. It's great to have you. And now I would like to introduce Dr. Maiyia Kasouaher, the Community Engagement Lead in the program in Health Disparities Research.
Hi everyone, thank you Maureen for inviting me to be a part of this conversation. As Maureen mentioned, my name is Maiyia Kasouaher, and I am from the program in Health Disparities Research. In addition to my role at the university, I do want to share with you that I am part of a community-driven research group called SOLAMO, Partnership for Health and Wellness. And SOLAMO stands for Somali, Latino, and Hmong. And in this group, it is made up of community researchers partnering with academic researchers. So that's my role outside of the university that provides insight on the work that I do at the university as well. And so I will start today with, let me see. Okay, there you go. Just a quick overview of PHDR to give you some background on the programs and activities that we do in the program in Health Disparities Research, and then highlighting the community engagement component, one grant, the Rapid Response Grant, on how we are engaging communities in this conversation and a part of this grant project. So let's see. The program in Health Disparities Research was created in 2005 to promote health equity research across the medical school. It is led by Michelle Allen, who is the director, and the co-director, the associate director is Sue Everson Rose. Is made up of a core of 6 faculty affiliated, university affiliated faculty, as well as 6 leadership and staff teams. So the 6 leadership and staff team are the ones that are overseeing the different programs and activities in the program in Health Disparities Research. Our mission then is to promote health equity through collaborative research, innovative education policy, and trusted partnerships. And the vision is to eliminate health inequities in Minnesota and beyond. So we work with 3 operating values. And these operating values, we have received feedback from our community partners, our community academic board, and faculty and staff within the university as well that partner with us on what these operating values are. So the first one on social justice and racial equity, we aim to seek to create systems change that centers and champions diverse and marginalized perspectives. Our commitment to social justice and racial equity guides our decisions regarding hiring, programs, activities, partnerships, and budget priorities. And the second operating value that we listed is community-centered partnerships. So because communities are at the center of what we do, we nurture equitable and mutually beneficial community-driven and community-centered collaborations based on integrity, authenticity, transparency, and fairness. And the last operating value is translating community knowledge into action. And we believe that community expertise and knowledge are essential to eliminating health disparities. So through collaborative research and dissemination, we co-produce knowledge that generates meaningful action to advance health equity. And these are our goals that guide the way that we make our decisions within the program of Health Disparities Research. And we try to align the things that we do to these operating values. There are four areas that we focus on, and it's research, education, policy, and community engagement. And so today I will be talking about community engagement, and I will end with that last. So just to give you a brief overview in terms of research in the program in Health Disparities Research, we do have multiple grants and ongoing grants that are led by our core faculty team. And so you can visit our website, healthdisparities.umn.edu, for more information on the different ongoing projects. But here I just want to share with you, these are the new grant awards this year that our faculty have been awarded. And this is just some of the awards to give you an idea of the different areas, different communities, different health topic areas, different health topics that our faculty are working on related to health disparities. And one way of how we engage community organizations in research is through our Health Disparities Pilot Grants program, and I coordinate this program. It is an annual award of $25,000. The research topic is identified by the community members and organizations. They can submit a letter of interest without an academic partner, and I will try to match them to a faculty at the University of Minnesota who is interested or doing work in that topic that they're proposing and is interested in doing community engaged research, right? So trying to connect community partners to academic partners in this process as well. Community organizations can also submit a letter of interest with an academic partner already identified. And they will go through this, this pilot grants process, and we try our best to provide as much information up front and help guide some of these community organizations in submitting a grant application. Some of the community organizations have submitted grant applications, have never submitted academic grant applications in this way, and then others have. And so really trying to find a balance and provide the needed assistance that would help these community organizations that haven't had this kind of experience. We also provide partnership support in this process as well, especially for the newer partnerships that would benefit from learning about the resources that we have related to partnership development and partnership support. And these are the four newly awarded projects that are for this year and next year. And we still have some current ones going on. These are the ones that, as you can see, are working with different communities on different health topics as well. And these are all, this grant is funded in part by the Masonic Cancer Center. So there's a cancer research focus on this, as well as by the Community Health Initiative Program in the OBCED, so the Office of Business and Economic Development program within the university. And that particular one is funding a research project focused in North Minneapolis, so looking at health disparities in North Minneapolis. So this is one way in which we are engaging community organizations in research and supporting them in this respect. In terms of education, we have a health equity and leadership mentoring program, and which we call HELM. And HELM is designed to enhance the academic and excellence of the leadership capacity for diverse faculty and health disparities researchers. that are aiming to reduce health inequities. It also focuses on challenges that trainees from minorities and underserved groups and other faculty are experiencing. And so there's a cohort of folks who are in this program, and then they have a faculty mentor to help them through this program as well. Another program that we have for education looks at the Cancer and Health Disparities summer internship program. And this one is for interns who are undergraduate students, either who live in Minnesota or go to the University of Minnesota. And for our 2020 cohort, we had 10 interns this past summer. It's a 9-week program, and they are matched with, so these are undergrads who are matched with research mentors to provide them hands-on research experience. They attend weekly seminars, and they get an opportunity to do some clinical observation. And this is an annual, these are all annual programs, educational programs that we have. We do have a newly funded R25 training program called MSN, Advancing Science, Enhancing Diversity. And in this one, in this particular program that is led by Michelle Allen, Chris Pinnell from the Masada Cancer Center, and Sue Eveson Rose, was funded by the National Cancer Institute. And the goal of this particular upcoming program is to enhance diversity, the diversity workforce of the cancer researchers, right? And we are working with high school students and undergraduate students who are interested in science from diverse backgrounds to see, to help them provide some hands-on experience so that they hopefully then would be interested in continuing cancer research when they continue higher education. And so in terms of, and I did not put a slide on policy in here, that is one area that we are still working and developing within the program of Health Disparities Research, hoping that the work that we do will somehow influence policy in a meaningful way for the communities that matter. And so in terms of community engagement, we have an annual Power of Partnership dinner, and in this annual Power Partnership, it is where we invite community members. It's open to the public and free, right? So we invite community members and university folks as well. There's a distinguished visiting scholar with extensive community engagement experience who comes to speak. And so this is an annual event, usually that happens in February. And there are poster presentations before the speaker. And these poster presentations are from different research projects that are happening with community members, community organizations, through the different partners that we have at the university as well. And so this is a great opportunity for community members to learn about what other research projects are going on in different communities, as well as an opportunity for them to network with folks within the university. Another community engagement program that we have in PHDR is the Community Dialogue Series. And this Community Dialogue Series idea is for communities to identify a topic that they want to engage with a university researcher on. And so then we would work with them, we would work with that community to plan a dialogue or conversations. And we started having conversations with a Somali community on the impact of opioid use in that community, especially with the youth. That started, and we were planning some conversations, but then COVID happened. And so we had to put that on hold. My hope is that by next spring, we will be able to continue those conversations with this community. The topic of opioid use in the youth in the Somali community was actually brought to my attention by Representative Mohammed Noor, representative in Minneapolis. And he explained to me, shared with me that this is an issue in the community, that they need to do something to engage community folks to have these conversations and figure out what it is that they can do to resolve some of these issues that are affecting the youth, the Somali youth. And so this was identified by the community members, and they wanted to partner with the University of Minnesota to see what resources we have and how we can leverage our resources to help this particular community figure out ways that would benefit them and that they could learn from in terms of addressing the issue of opioid use with their youth. Another component of community engagement that I'm currently working on and finalizing is a community-centered dissemination toolkit. And the reasoning behind this community-centered dissemination toolkit is that we know that dissemination has its greatest impact when it engages the community. There's feedback from community members and participants saying that if they were part of a research project, they either don't hear back about it, right? They don't hear about the findings and results, or if they do hear back about the findings and results, it doesn't make sense to them, or there's no meaning behind it, right? And so how do we make sure that dissemination and information that's being shared about research findings are meaningful to community members? And so within PHDR, we believe that community engagement is vital to this process. This is also an issue that academic researchers have voiced concerns about in terms of not being able to or not knowing how to share and disseminate information back to communities in ways that are meaningful to those communities, right? And so this is a toolkit that we're developing in PHDR to establish and practice equity within the partnerships, right, within the research partnerships, to include community members in this dissemination planning process. And the toolkit then includes multiple worksheets that would help these research teams get together and think about what the dissemination plan is and how they can better engage community perspectives and decisions in this process. And so for this particular toolkit, we will be finalizing and having a launch in early December to share the toolkit with both community and academic folks, and it would be made publicly. There's another component of community engagement that we do is partnerships and collaboration. So we collaborate with different state departments, community organizations, and across university colleges and schools. You know, some things that we are working on are, for example, with the Minnesota Department of Health Center for Health Equity. They have their Health Equity Summit planning event and the Health Equity Summit, right, event. And we participate in that, and we partner with them as planners and being on the planning committee for that event. There's other projects and opportunities within different community organizations that we work with to collaborate to make sure that, you know, whatever issues or resources we might have at the University of Minnesota can be shared with the community organizations.
We had a question in the Dr. Hansen is wondering, what are 1 or 2 public policy initiatives that would reduce healthcare disparities, if you wanted to elaborate?
I think that, so my area is not in policy in terms of the work that I'm doing right now, right? But I think that in terms of the impact of community engagement on shaping policy and how research, the different ways in which research groups can include communities and community perspective, my hope is then be able to shape the way that policy is interpreted and shape the way that we understand what that looks like for community members. I think that in terms of specific policies, there are potentially policies around the reimbursement and payment of clinics, and what should clinics be able to reimburse for, right? That's one project that I was a part of in Solamo to look at quality measurements at the state, and including community perspectives on what is it that community members want to see reimbursed. What are the issues? What are the ideas of what quality primary health care looks like, and how can those perspectives help shape the way that we understand and see what should be reimbursed to clinics? So, like policy-wise, in terms of reducing health disparities, looking at the social and structural determinants of health, to include those to help us interpret and understand the way that we reimburse clinics, because we know then that how clinics are reimbursed also influences the amount of resources that those clinics have, right? So higher resource clinics versus lower resource clinics, and the different patient population that go to each of these clinics, right? And so you're looking at health disparities between the patient population, these patient populations, then, to include their perspectives to help shape the way that we think about how we reimburse clinics could be, I think, a really important policy that would influence the resources that some of these clinics receive. I don't know if that exactly answers your question, but in terms of with my experience doing some work related to health disparities that could influence policy, that is one example that I can share with you. One thing I do want to share with you in terms of PHDR is that we have a community academic board, and our community academic board consists mostly of community members who are not affiliated with the university. They are decision makers in helping us guide our programming and how we partner and think about partnering with community organizations and members. And so earlier this summer, we, because of the social unrest in Minnesota with the killing of George Floyd, our community academic board worked with Andrea Jenkins from the Minneapolis City Council to publish this article on addressing racism as a public health crisis, right? And giving some suggestions, ideas on what the next steps could be. We also work and include some of our community board members in creating the second bullet that I have here, best practices for community involvement and institutional change making, giving them suggestions and ideas with the university or other larger institutions on how they can change the way that they think about and include communities and what some of those best practices are. And so there are different ways in which we can include community and engage community members in the work that we do, right? It could be writing an article, it could be including them in research and dissemination, different process and parts of research as well. And so I just wanted to share this with you to give you an example of other ways in which we try to include community members in PHDR work as well. And so I want to highlight the one example of community engagement that we are doing related to COVID. We have a COVID-19 resource list, and this resource list was compiled in partnership with several other community organizations, and being maintained by PHDR staff. Being maintained and updated by PHDR staff. And this is also can be widely shared and made public as well. But what I do want to focus with you today on is the work that we're doing for our rapid response grant for optimizing communication strategies for reaching at-risk Somali, Latinx, and Hmong elders with timely COVID messages. And to go a little bit more detail about this, we are doing this work because elders 60 and older are at an increased risk of severe illness due to COVID. And that there are multiple barriers to reliable information in terms of language, technological literacy, maybe literacy in their first or native language, especially for Hmong and Somali elders. There's issues of misinformation and perhaps the distrust of the source, right? And so because of all these multiple barriers that could impact the way that folks do or do not receive information about COVID, there's one more familiar source of information, and that is through the clinic and with their doctors. And so patients who go to the doctors can ask about COVID, and whatever information they receive tend to be more taken more seriously, or that they rely on that kind of information a bit more. And so what we're doing is we are partnering with the Community University Healthcare Center, or COOC. We're partnering with Solamo Partnership for Health and Wellness, and with Welshare International, and through that, the Islamic Civic Society of Minnesota. And so with these partners, we are using a participatory approach to address and work on how we can include community partners in these conversations. We're disseminating 6 culturally and linguistically specific language messages to COOC patients, and the communities of identity are the Latinx communities, Mali and Hmong, and the 6 messages then we include 4 audio messages and 2 video messages. And so in terms of our analysis process, then we are planning to do phone interviews with 60 of the patients that have received the messages to assess the reach and to assess the response to the messages. So we're planning to interview 20 from each community, 10 from ages 18 to 59, and 10 ages 60 and over. And the reason why we have decided to break the ages down is because we understand that in many of these communities, in the households that they live in are intergenerational. And so if a youth or somebody younger receives this information from the clinic, are they likely then to share this information with the elders in their family, right? And so our messages are in those specific languages, so they're not in English. We work with clinicians at COOC. We work with community researchers from Solamo and with Welshare. Welshare is doing work that is parallel to this, and so there's a lot of insights that they have related to this kind of COVID messaging. In the phone interviews, we're planning to ask them about the preference of the method of delivery. So if they prefer a phone call or a text message, and the delivery format. So if they prefer something that's written, something that's just an audio message, or if they prefer a video message. And those are the different components that we're looking at. And the reason behind that as well is that we hope that with the findings from this, we'll be able to share with other clinics who are serving similar patient populations, the strategies and preferences that specific communities are telling us that would be the best ways to reach them, right? So we're talking about patient communication from the clinic and these strategies that could help clinics better communicate with their patients. So we're hoping that it has a larger implication beyond the COVID messaging. So I do want to share with you see if there's a video that we've worked on. And we got to check to see if this could play. Sorry. Let me stop share and then let me pull up the video first.
While we're waiting, I just want to remind everybody that if you have questions for Dr. Kasouaher, please feel free to type those into the Q&A box. The icon is at the bottom of your screen.
And so that's one of the videos that, hold on, let me see if I can. Okay. Back to my presentation. So that was one of the videos that we worked on, really just emphasizing the different ways of different times when you wear a mask to the community members, the different times when you use hand sanitizer, how to still be socially connected, but in a safe way, right? So keeping that distance and staying outdoors. And, you know, if you need to take a breather, you need to step away, right? Before you can remove your mask and things like that. And so these are just some of the messages that we wanted to portray to the different communities. And the writing at the end, the message and the writing at the end there is in Hmong. And that one, talks about how we need to love and protect, love each other and protect ourselves to get through this virus. And that's the message that we wanted to give to community members. And so we're developing 3 different videos for the 3 different communities with community members, representative of those communities in those videos. And then just one last comment or idea that I wanted to elaborate a little bit more on is community partnerships and health research, and why it is that it's important for us to include community knowledge to make sure that research is relevant, and talk about the different ways of and types of research and different ways to engage communities in research. And because in the work that we do, we won't be able to do what we do without our community partners, right? Especially with that last video that you saw, to get community input on what works, what doesn't, what's important, what's not, what are the trends that they're seeing and related to COVID, and how people are or are not protecting themselves, right, and taking precautions. And so we won't be able to do what we do and have the insight that we have without our community partners. Because then community partners are the experts. They're the ones with the knowledge. They're the ones with that lived experience from those particular communities to help us interpret and understand what these things look like and how it manifests in the daily interactions from those communities. And so ideally, the best method to engage communities is through a community-based participatory research approach, where community members who are representative of that participant population are decision makers and have an equitable role in the research project and design. And I understand that this is hard to do. Working from a CVPR perspective is hard to do, and that not all research topics and ideas are suitable for a CVPR approach. At the same time, there are different types of research, so there are different ways in how we do research and different entry points, right, that you can think about including community members in. So for example, if you're doing things like, if you're doing a basic science research and you are thinking about engaging communities, you might be able to think about engaging them in the recruitment process, right? Engaging them in recruitment decisions, or engaging them in the dissemination planning decisions. Once you have your findings, once you are ready to share the information back to the participants, right? How do you engage communities to make sure that the way you're sharing information back is relevant and meaningful to them, and they can make sense of it? They can see how it relates to their experience, and they might be able to talk about it with the providers based on, you know, the findings that they were a part of. And so there are different components to a research project. From the design and the recruitment, analysis, interpretation, and dissemination that you can include community members in, depending on the different type of research that you are working on and the topic as well. So I just wanted to leave you with that last comment, and just if anyone has any questions.
So Dr. Jim Hart responded and commented with regard to Dr. Stuart Hansen's question about policymaking, saying that perhaps better funding for housing and education would be appropriate. And I know that PDHR is is focused on research, obviously, but do you know of groups that work with communities to do advocacy for better housing, better education that might help reduce healthcare disparities?
I know that there are different community organizations out there that work with specific communities for specific or specific areas. And so I know that there are some that are focused on advocacy, and I think because of our role in PHDR that we try to use what we have and what resources we have through the university to make some of these connections. And you know, you're right that there are social determinants of health, right? Like housing, education, that are related to and directly impact health disparities and outcomes related to that. And so I know that I mentioned a little bit earlier about the quality measurement, looking at how clinics are reimbursed. And in those conversations, that's one of the things that community members bring up, right? They talk about other social determinants of health that are affecting their inability to follow what the doctors are telling them to do. And to look at things like historical trauma and how that impacts the community and how the community sees and understands their own health because of historical trauma, and then to have doctors and physicians understand and clinic staff understand how that impacts that particular community and potentially that patient. And so in looking at the spectrum of different things that impact health disparities, that have policy that could impact and reduce health inequities, is that in our conversations at the Department of Health, looking at quality measurements, we do branch out beyond that to talk about the different roles that the criminal justice system has in reducing health disparities, different roles, housing, education, or employment, all the different roles that these different sectors and silos have, right? And how do we merge and connect these things together, and who plays what role, who should be reimbursed for what, and if there are certain things that the medical or the payers, right, insurance companies would be responsible for reimbursing, to think beyond what they are used to, right, that could impact health disparities. So really looking beyond that as well too, and it's much more comprehensive and much larger, and that's still a conversation that is being had at the Department of Health, and things are a little bit slow on that end because of COVID and the priorities that we have right now.
Okay, well, thank you for that answer. And we have another question from Dr. Hart. He comments that you mentioned concern about the opioid addiction problem. What other health concerns come up in your community conversations?
And so in past conversations, I believe they talked about diabetes, they talk about heart disease in different communities, right? And I wasn't here in my role for those conversations. So I don't know exactly how those conversations went because I wasn't here yet, but in the work that I'm doing right now with the Somali community really is trying to understand what role I have, how I can use what resources I have through the university and through other community partnerships to make sure that this issue is addressed by the community in a way that the community has decided is meaningful for them. And I think for me, it really comes down to that process. So in terms of other examples of issues that are coming up There are several different issues that I learned from the pilot grants program, where community members submit a research idea that they want to partner with the university on. And some of these research ideas are ideas that they're talking about, let's say, sexual and reproductive health in a certain community, right? And they're the ones who are identifying these issues. And so I am getting a sense of, the different health disparities issues that community members are identifying through the letters of interest that they're submitting for our pilot grants as well.
While we're waiting for any other questions to come in, I will ask, going back to the dissemination of information to the communities after you've done the research. You mentioned that you have a team that's working on a plan for that will be released in December. How are you involving community members in the development of that plan?
And that's a really great question. I think that's really important in thinking about the process of the way that we do things, right? And so what I'm doing right now is I'm involving our board, so our community academic board first, on getting their feedback on what it is that we've developed. And then also sharing it with different groups throughout the university who are working with different community partners to see if they might want to pilot and use some of these worksheets in their partnerships to see what works and what doesn't, and get additional feedback from community members that way as they're using the worksheets. And so this is not a static document, but it's an evolving document, right? And when we launch it, it still is going to be an evolving document as folks look at it and as they use it and they tell us, you need to change this or add that, or that's not so user-friendly, or community members, when they pick it up, they won't understand what's going on. And so I think there are different ways in which we can continue to engage community input and the work in the product. But in terms of the development portion of it, it came about with several other folks affiliated with PHDR who wanted to do something related to dissemination. So when I came on, this topic was already something that was discussed with community members and academic folks. And so some of those ideas are then carried throughout what it is that I'm doing as well.
All right, we have a few minutes left if there are any additional questions. If not, I want to thank Dr. Kasouaher very much for your time today, for presenting the work that PHDR is doing in this critical area. Reducing healthcare disparities is so important, especially for the minority communities that you are serving. I don't see any additional questions, so I think we can end a few minutes early. I want to thank everyone for coming today, for signing on. I know many people are tired of being on Zoom meetings or are brand new to it, so whatever your situation is, we greatly appreciate your being here. Again, the recording will be available on the Alumni Celebration website if you want to review it or share with anyone. And Dr. Kasouaher's email address is there if you have any additional questions for her. Thank you so much for coming, everyone.
Hey, thank you.